Welcome to another episode of Health, Wealth, and the Ultimate Self. I'm here with a special guest, Scott Pollock, owner, founder of Greater Than Performance. Again, licensed massage therapist is probably the first kind of thing I knew you as. But again, then now you own a business. You do neurotherapies that I think is really unique. So I have a few patients that kind of go to you and like depend on you for this, and I think people would benefit from hearing what you do. So welcome to the episode.
Well, thank you. It's great to be here. And a lot of respect for you because you probably have a much more thorough knowledge of some of the things that I do without actually knowing in depth what I'm doing.
Hey, that's okay, but you do it well.
Yeah, but it's mainly a combination of different techniques to get the neuromuscular system to relax. So a lot of the people that I see now who you're specifying are in some type of chronic pain. And a lot of the chronic pain that I see is caused by a chronic tension of that neuromuscular system. And it requires a combination of different therapies that provide therapy to the nervous system to actually get it to relax, and then the soft tissue and the corrective exercise to reinforce whatever we're trying to do. But mainly it's just to get the body to relax. So there's different techniques that I utilize to do that.
Nice. What's that technique or therapy called?
So the main one I do now, which is kind of the bread and butter that a lot of people don't know about, I think mainly because they are terrible at marketing, which we talked about earlier, is so important for business owners, is proprioceptive deep tendon reflex. So PDTR is the acronym, and it's a system of treating the sensory receptors of the nervous system. So I like to use the analogy of if I was to stab you in the arm, you would have a sensory receptor feedback to that pain in your arm. So for instance, you would have certain nociceptors that would become overly stimulated and create a lot of tension in this area. You would also have different responses. You'd have a nociceptive withdrawal response. Your body would move away from that pain. And even after it heals up, and this could be an injury anywhere in your body, you would still have those same sensory receptor complications from it holding tension in this area, or those sensory receptors staying overly stimulated.
It doesn't always reset, right?
It doesn't always reset.
Yeah, I think that's as a provider, you think like, hey, my shoulder's sore, I tweaked it, stayed off it, did a little rehab, it's better.
Yeah.
But again, from a neurological standpoint, I think that's the one part. If you're not looking for it, you may still have compensations that may over time yield to like postural changes, pain syndromes. I think that's the interesting part, which
your body is the great compensator, which is great, but at the same time, it can also cause problems.
We harp on that all the time, because especially in like the concussion world, or when people like even the post-COVID, like, man, I got sick, and how did this create like this neurological response that has now lasted for 2 years after this, something that seemed like pretty arbitrary. I had sick, got a fever for a couple of days. Like, if people were compensating, or their neurophysiology was kind of leaning that way, again, our brain wants to compensate. It wants to experience this world, feel safe, and do whatever it possibly can to do that. And so as a consequence, you compensate. And again, some of the compensations are good for short periods of time, but when they become permanent, I think that's when you start to see issues. And you see it a lot in concussions. They might already have some weaknesses, and they get hit enough traumatic brain injury, and now they might lose some efficiency in the vestibular system, and they didn't have that wiggle room to compensate more with the visual system. And now they're like, I have chronic headaches and motion sickness. Like that. But you had neck issues for like 10 years before that you already were compensating for, and again, you just were able to get through it fairly symptomatic free, and that concussion now kind of took another system off board. But again, it's last podcast, I think it'd be interesting if you go listen to that one. It was basically the paradigm of functional neurology and the continuum on it, because I think whether or not you know it, you're playing in this functional neurological world, right? And so again, it's about using different sensory tools to have an influence into the neural axis. And again, that was kind of what we're talking about, because I think in the functional neurology world, you go to a conference, it might be an ortho, it might be a physical therapist, it might be a massage therapist, it might be a chiropractor. but it's really a paradigm, right? It's like whatever tools you come in, it's the philosophy that you go in with. It's like, I have these different tools. I can shape the neurological axis, whether it's an eye exercise, whether it's neck work. But when we do those sensory therapies, they go somewhere into the nervous system to have an effect. You can go from brain down or organ up, right? So muscle up to the brain. That's the beautiful part about the paradigm. So I think when you kind of going into this, I think it's fascinating because you're kind of just addressing from a slightly different tool base than that we approach the nervous system. And the cool part is you get results, we get results, and it doesn't matter at the end of the day. It's what the patients like respond best to.
Yes, absolutely. And just to finish the analogy.
Oh, sorry.
So stabbed in the arm, we have a heightened sense of these sensory receptors. PDTR comes in and we mimic the stimulation of that sensory receptor and provide a certain technique, this proprioceptive deep tendon reflex.
Mm-hmm.
And that technique allows that receptor to relax. And whatever tension or effect that overstimulation was causing goes away. And then you can really get in there with your ART, active release technique, with your FDM, whatever type of soft tissue you're utilizing to try to calm down that tissue and get the fascia to relax, whatever you're trying to do. And then you put in the corrective exercise and you're able to actually engage what's meant to engage. You have more mobility, all that stuff. So that's the technique that I use, and those are the combinations of tools that.
So if we kind of go down to muscle neurophysiology, so you're playing on is it the Golgi tendon organ kind of mechanism of the myotendinous junction is where you're trying to change like the firing rate to basically allow unconscious muscle tone to change?
Yes, and it depends on the receptor because like in PDTR, you'll go over the effects and stimulations of every different kind of receptor that your body has. So if we were doing like, let's say a baroreceptor, it'd be more pressure based.
Yep.
So we'd recreate pressure. If it's a neospinal thalamic receptor, it'd be more of a pinching or a stabbing sensation. Yeah, we actually use toothpicks too.
Hey, that's right. Pinwheels.
Yeah.
Makes sense.
Golgi would be more of a stretch. So the mechanoreceptor. Vibrational receptors, there's like 5 different kinds of those.
Yep.
So it depends on the receptor that we're trying to stimulate, and then we mimic the stimulation, see if it's a problem with muscle testing, and then we treat it.
Awesome. So you're doing kind of like a pre-assessment, apply a sensory stimulus that kind of falls within the receptor, and then you're basically retesting and seeing how the muscle responds to the input.
Yes, but the coolest thing about PDTR, in my opinion, is that you can trace the cause of the fractal that the compensation came from. So let's say that you have adductor tension.
Okay.
So you're going to have mechanoreceptors in that adductor that are overly stimulated, creating some of that tension. The only problem with treating that adductor is that it might just be part of a lower fractal of some other cause that's causing that to be tight. So in PDTR, we can trace up to what the head of the snake, we call it, which is causing all these downstream effects to happen. So a lot of the time, adductor tension might be related to a contralateral QL problem or an SI joint problem. But if I just treat the adductor, we're not going to get to the cause. So in PDTR, we can trace up the hierarchy to figure out what the actual cause of that compensation is. So that's what's cool to me, and then hypertonicity as well. But yeah. So
we need to get you. I think it would be interesting. Like this weekend, like the Carrick Institute's coming and doing a functionology like primer. I think it'd be interesting to have you go there and just more so like layering on like your therapy, and because again, like or coming to the office and you assess, we assess.
I'm not an expert or anything.
No, you are though. And what you're doing, and again, I think because we're still trying to put our hands in and modify. It's just kind of how the lens of which we're looking at that patient might be not different, but like, hey, we're going to come in and attack it from here, right? So let's say the right cortical system is going to be huge for like autonomic output, and that autonomic or that fight or flight response is going to be what changes flexor tone and changes your postural tone. And knowing that if somebody has right cortical or right brain that's not as healthy and thriving, not getting as much blood flow, then its ability to descend down and dampen the groin or the flexors is going to be not as efficient and can allow it to ramp up. And again, it's the same thing though, like how do you approach it? You can go downstream and change the sensory system, but you actually might have to go on the opposite side that impact the opposite brain. That's the beautiful part about neurology. It's like there's so many ways into it that you can influence it. And again, I think that's the cool part. Is just
beautiful and chaotic at the same time because it can be very complicated.
Right, it's the chicken or the egg. Like you can always have this argument, but at the end of the day, if you address this response and the patient does well and responds well, that's the kind of the clinical piece that matters.
That's true. I will say that my treatment and therapy, especially PDTR, is not good at treating systemic issues.
Mm-hmm.
So if they have an issue up there and they're in a fight or flight state, or they're high stress, or they can't technically relax their body, like fibromyalgia people are really hard, ironically, for me to treat because they won't relax. So I can't get a good stimulation or muscle test on somebody that's always creating tension.
Mm-hmm.
So that would be somebody that I would refer out to somebody like you guys.
But and again, this is kind of the interesting part, talking about, like you said, no C-section and pain, and understanding like the biochemical aspect of that messenger system. Like, going through there's a chat forum, somebody had like, anytime they get muscle rubbing, like a massage, even if it's light, or they do cupping, like 30 seconds of cupping, they're in extreme pain. And this is like this mold chat forum. And so again, I just chime in because it's like, people are like, oh, you're detoxing. I'm like, it's a bruise. It's that bruise. Black circle that you got after 30 seconds has nothing to do with mold falling out of your body or plastic. Like, and again, because yeah, you might be doing some type of detox, but that's not why you have a black circle. And it's also not why you're sore after. There's much simpler explanations when you understand like the physiology. It's like, hey, look, we know a lot of people with mold issues get secondary histamine or mast cell responses. And what does histamine do to the vascular system? It permeates it. If you picture that histamine is a stress kind of modifier in the periphery, so if you have like some acute threat, you want to be able to get your immune system to that threat to try to rescue it, to fight it. And so when you look at histamine, like you're going to bruise potentially easier, you're going to get red easier. And that's where I'm like, that's probably what is going on. And when histamine shows up, you're going to release like chemical mediators like substance P that then takes that pain fiber and makes it louder to your spinal cord and your brain, or ultimately perception. And so I was just trying to explain it. It just, you had a lot of like kind of at home, kind of Google educated people talking about things. I'm like, it's probably a histamine response. You have mold. There's like, we know that probably over 50% of people get those responses with perpetual mold exposure. Why don't we just simplify it? Hey, like, have you ever done any like antihistamines? Like, how do you feel with that? Like, trying to just like be very simple. Like, maybe your provider could recommend you an antihistamine, then get a massage. Is your pain less? And then start using that information to like, hey, maybe that's like something we need to further explore about solving why they have pain sensitization too.
Do you know what? That just makes me think of something that I wrote a blog post on. I think you're low battery over here.
All right, we're good. We're cooking.
We're still going.
We're still going. Don't worry.
So what I was saying was, I think that makes me think of a blog article I wrote. How's your back doing, by the way?
My back's good. So
okay.
I have, don't want to go into it much, but was a bit of an idiot, hurt my back, taking a few weeks off, and probably 2 weeks ago I couldn't sit here.
I can't tell if you're really interested in what I'm saying or if you're
I'm very
fidgeting around because your back hurts.
No, I'd tell you.
Okay.
My back has been good for about 10 days.
Okay, perfect. Well, let me know if we need to do something around.
I was more so like, so our charger's plugged in, so I don't know why my phone is like not staying powered up.
So interested, it's getting juiced out over here.
So I was just like really dialed into like, what the heck's my phone doing to me right now? Because the microphone's powered, which tells us there's juice in the system. It's just for some reason the phone's not charged.
That's a cool microphone, by the way. But anyways, let me get back on topic. So I wrote a blog post called The Stress Threshold.
Mm-hmm.
And it's about, we can have all these different stressors. We can have physical stress, we can have chemical stress, we can have emotional stress, physical stress, up to a certain threshold. And then our body starts really producing symptoms and creating inflammation and causing problems. And it's like, how many layers do we have to unravel or get underneath that threshold for the healing process of the body to take over. Because I feel like lots of people have small amounts of bad bacteria or mold or certain chemicals or allergens that other people, it causes inflammation because they're over that stress threshold. So how many of these people that are dealing with these chronic issues could we get underneath that threshold with different modalities to where some of their problems that they're currently thinking are at the top of the food chain dwindle away? And that's what I think about all the time with people that come in with chronic pain, because chronic pain is never just one thing.
No.
It's always a combination of different stressors that are causing this person to come over that threshold.
And that's a very good point, because literally every patient that we sit across, like that's the part of the conversation, because they want to know, like, why am I like this? Like, how did I get to this spot? And, you know, I think conventional healthcare and medicine wants to say, like, it's a very simplified answer. Like, it's one thing did this. It's like,
And they want that.
And they want that. And then again, and the unfortunate, it's like, look, like, it's probably a combination, but there's things that were filling up your threshold cup. And I think there's ones that are more stressful than others. And as a provider and as a kind of clinician, those are the ones that you have to kind of use your experience, use your assessment, use the history. Like, when did this start? Well, it started after I got sick with this. That was like, then I wasn't as good. I was doing better though. I started getting better. Then this happened. And you can use those history things of like seeing like when the cup got tipped back up and filled back up. And then you can start using like, okay, well, like deconstruct it. This is what kind of bucked the system. And not to say that there wasn't some issues going on previously.
Right.
Like, hey, these three things kind of all line up to when symptoms like went up a tier. And it's still going on. If we can remove those, can we get you back to that, like basically that a cup where you can now handle what's in that cup, and we can start walking you through a much more like day-to-day way of handling what's left in a much less aggressive way. Like it's just one of those things, like how do you be as minimal as possible but get the person to the outcome as fast as you can? And I think that's the art of kind of trying to be a clinician. Like you might find 50 things on a lab, but you're like, man, like that's overwhelming. If like go do this, wash your hair this way, dance on your toes, rub your head, like how do we go after and be like, here's a variable, we're going to modify it and we're going to see how you respond to it. We're going to do this variable and see how you respond. And again, I think the art in doing it is if you can get them to respond by doing less, then that's, again, there's more finesse as a provider. And I think that's, again, we see it all the time though, because they want a simple answer, like, just tell me this did it. Tell me it was the alcohol. I need to stop drinking. I'm like, yeah, it probably doesn't help it. But there's also this issue going on in the gut, that concussion you got back 7 years ago, like probably all these things like had a factor. And we have to kind of reverse engineer a game plan for it that makes sense.
You know, I think it's hard to say, like, I feel like there's an epidemic right now from what I see every day, but it's just what I see, right? And I think we attract kind of, I don't know what we see, but like, I feel like there's so many people right now dealing with some type of gut health. And I think it's a combination of poor diet and just massive stress. And like, diet is so important. And I think it could help a ton of these people who are coming in with chronic issues. And even the people you see, I'm sure, the diet is just, you are what you eat. And inflammation can be so easily triggered by things that you're ingesting because you're literally doing it every day. And like for me, I just say that because anecdotally, I cut certain things out of my diet a few years ago when I was dealing with some of my own stress and things that we'll get into during COVID and starting a business and all that stuff. But after I cut those things out of my diet, like for instance, I used to have horrible allergies. Like they'd take me out for at least 2 weeks, 3 times a year. As soon as I started cutting out dairy and gluten and ironically chicken and onions after I got my food sensitivity test, because those were sky high in the red for me, I don't get allergies anymore. And it's the craziest thing in the world. And no offense to the allergy doctors that I saw before, but they were basically like, you know, you're gonna probably have to take these shots for the rest of your life. And not only did the shots not completely resolve my allergies,
I don't think I've ever seen them have a long-term like resolution on anything. Like maybe tone them down and then they kind of like regress back.
getting the diet straightened out, oh my gosh, night and day. It's crazy. I recommend that everyone go get some type of food sensitivity test, micronutrient test, something to see what inside their body, what's going on with what they put in their body or what they're lacking.
Well, it's interesting, right? Because what you should not eat might be different. And I think that's the part, again, going back to healthcare, is your game plan should be personalized. So,
oh yeah, those things are just for me. I'm just saying everyone probably who's dealing with some type of chronic issue, really everyone in general, probably has things that they're sensitive to, or that they would be better off eating this certain way and they'd have less problems.
So I had a patient recently, like probably about 3 months ago, and again, young, new family, like not a ton of resources, and so we ran some testing that we could do, and again, very thorough testing with what we could do through like your typical insurance, but again, showed some things, but it's like, hey, it looks like there's this like bacterial yeast component. I really like to do some more testing to explore that. A stool sample. I'd love to do some food tests, and they eat. This young person eats and gets really bad GI pain. Again, here's the resource. Here's what it's going to cost. A few $100 for this test. Or I think this is what's going on. Let's just make your barrier system be a barrier again. Let's take foods that tend to be the common culprits. It may seem like, again, like let's put you on an AIP diet. Like let's remove the usual offenders. Now, if it's chicken, it's still on there. And so this person, like it was red meat for them, but they removed these things, and every time they'd eat red meat, they noticed that response. Like, all right, let's pull it out. Again, you got to buy time for the tissue to heal. You have to get, and again, like that's, if you picture your GI as like this coffee filter.
I love coffee.
I love coffee too. And would you love coffee if you always had coffee grounds in it? Probably not. You react a little bit, right?
Yeah.
So if you picture like your GI is like this coffee filter, and if we kind of tear little pieces in it, you start getting things passing through that normally shouldn't, you're probably going to start to have reactions. Your immune system wants things to be very, very small when it sees it, because if they're big, it's like, oh, that might be a virus or a bacteria, because everything's measured off like Daltons in size. That's how your recognition system is in your antigen presentation. So when a protein gets presented, it shouldn't be a protein unless it's big and a virus or a bacteria. But if you digest something, you chop it up into these small fragments, like a nice small amino acid, your immune system's like, oh, you're not a threat. But if things are kind of leaking through before you have the capacity to digest them, your immune system starts to get zinged and just starts to react arbitrarily to things that really shouldn't be a threat. And so that's the aspect of even just starting at the gut, like let's just establish a barrier, right? And again, the crazy part is if you picture 80 to 90% of the toxins your liver filters goes into your GI. And if you have a leaky gut, 70% of those are just gonna go right back to the liver. So you start to see like how one little thing of like, hey, let's just make sure that filter is good. So whatever my liver is processing and dumping out into the GI doesn't go back to double time the effort through my liver. Because again, at that point, your body's like, you're gonna start getting behind the 8 ball, your cup's gonna get full on multiple fronts. And and that's really common when you start seeing like, I eat this, I just react. I can't put this on my skin, I react. You start seeing like your immune system is on this like over kind of heightened reaction phase, because your system's burdened. Like you've lost tolerance is the best way to, when you actually, if you want to go and look at kind of on the research side of it, it's like that oral tolerance, immune tolerance, chemical tolerance. When you lose the tolerances, that's like the food sensitivities, that's the chemical sensitivity. There's a beautiful researcher out of UT Austin. I'm not sure if she's still down there, but CS Miller, she measures like chemical tolerance and like what things cascade to kind of get you to that point. And it's pretty fascinating.
Okay, I have one more topic on this topic that I think will bring it all together, because what we've already mainly been talking about right now is how you fully treat somebody who's coming in with pain or with a problem or with inflammation. And in my opinion, you can give me your opinion here in a second.
Yeah, absolutely.
But my opinion is that there are certain things in a person's life that are causing a certain amount of stress that leads to the vast majority of these things. There is something at the top. That's why I love PDTR, because from a neurological standpoint, we can trace to what receptor is causing this downstream effect of tension. But what it doesn't trace, kind of, is maybe what's causing this systemic tension or stress that's causing all these other things to get worse. And what I find is that usually there's an event in someone's life, or there's something in someone's life that is causing them to have this level of stress that creates this lack of parasympathetic activity to actually be able to digest anything in the first place, and a breakdown of tissue happens. And so if somebody's never in a parasympathetic state or rest and digest state, how are they supposed to absorb any nutrients in their body?
Yep.
So there's something causing people stress that are chronically inflamed or whatever. Like, I have symptoms when I get stressed that is tension. I create tension. I have gut symptoms. I have different things that happen to my body that I could go and get treated for, but that wouldn't be treating the cause.
Right.
And I think that is something that Western medicine is just now aligning with Eastern medicine on, which is really cool to see. I don't know how much you see it, but
there's more acceptance of it, I would say.
But I would say that that's the most important thing, that if that could, I don't know how you would integrate that. Maybe I've thought about, okay, let me back up. Greater Than Performance and Rehab, my center was started to provide comprehensive care in the realm of like performance and rehab, or fitness and wellness. So physical therapy meets strength training, meets massage, meets chiropractic, all those things kind of in one place. But there's another aspect that I found that is more important, in my opinion, with people with chronic issues, and that is we're going to need a counselor. We're going to need some type of doctor that understands the mental instability that chronic stress comes from. And I think that is something that could help a lot of people eventually. Have you seen that?
Oh, absolutely. So I'm trying to think when we started incorporating that as like a big part of like, especially with a lot of the heavier, really difficult cases, like, and again, a lot of them like have found a therapist. Like, they might be seeing them 2 times a month, once every 2 or 3 weeks. And again, it's like, I always say to them, like, how often do you have that stress in your life? Like, what are you doing every day to help have a game plan for, like, oh, well, they talk to me like exposure therapy, and I'm like, hey, that's great. But again, it's like from a neuroplasticity standpoint, you know, what you water grows. So if the stress is more present than the things that you're trying to do to help rewire the brain, I think that's where people get stuck on those things. And I'm not saying this to knock any type of therapy, but I think the more people can have it in their day-to-day, especially early on, like, you have to create those like neurological pathways of where you want your brain to be functioning from. And so if they had trauma, and again, I think that's the other aspect you start to realize, when people are chronically sick with gut issues or hives and anxiety, nobody maybe physically held them down and had a physical abuse, but them being sick and having triggers around that, there's still trauma there that I think we started to appreciate probably about 5 or 6 years ago, because you start to listen to how people describe, and then they get super hyper vigilant of those symptoms. And so again, it's like, you know, if somebody comes in and, you know, they have a sniff of going backwards, the stress response, but that stress response of maybe going backwards is what sends them actually back. And again, it's like the brain's there to protect you, but in this case, like, that compensation is not adaptive. And so, I mean, we see it all the time. So we recommend different things for it. I like Annie Hopper. Have you heard of her? I think she's Vancouver. She does dynamic neural retraining. It's something so like people can put an hour in every single day, doing a lot of the already like cognitive behavioral therapy, like those kind of stress techniques. But when you hear people who've been like, whether it's chemical trauma, physical, emotional trauma, even their vernacular, like how they talk is like, oh, I'm just a stressed person. And it's like, but you're telling your subconscious like that's okay. Like again, it's like fake it till you make it, right? Like we want your body and if you want to be calm, tell your brain you're calm, like water that. And I think that's one of those things that I see all the time is like people get stuck very easily, and you have to address where they're getting stuck in that stress physiology or that trauma, and allow them to have like a easy regimen to put in to pull them out and take them where they want to go.
Or another hard thing, another instance is when they can't be pulled down. When maybe it's a spouse that's causing it, or maybe it's a workplace that's causing it. I have a lot of high-level CEO people that see me on a regular basis, and I've explained to them, like, we both know what's causing you to come back every single week, and they're like, that's not going to stop. And I'm like, well, I'll see you next week.
Yeah.
So some people, it's more of, I think people have, and we talked about this a little bit earlier, they have more peace of mind when they know what the problem is. But anyways, it lights me up to try to figure out what's causing someone's pain, because I think that's why most of us get into this industry, is to help people in pain and help serve them and get them to meet their goals. So to be able to really diagnose and see what's really causing this person to hurt is amazing.
And when you look at from a neurophysiology aspect, like the more you're in the anxiety threshold, then your perception of pain is going to be easier to elicit, right? Your alarm system is going to be easier to wake up, because again, it might be a tiger chasing you, but in reality, in today's, like, it's a lot of times it's just you're in this constant perpetual stress. Like we're always having a low grade tiger chasing us versus like that scare event. And then when you're always in it, again, your anxiety, you go through and you look at anxiety and pain is heightened. Your pain responses are going to be heightened. Histamine release tends to be heightened too in anxiety. We know that releases a different chemical cascade that changes how easy it is for your peripheral nerves to sense the pain. And so if you have to consider it. If you don't, you're missing a potential like opportunity to get that person better faster, or at least give them a more honest answer. Like you said, like, is the CEO going to necessarily just stop and retire, or can you be like, hey, this is at least where it's coming from. We know how you can compensate or modulate or kind of function within it. But at some point, like maybe when you do retire, like this is the time to like, hey, let's like rehab you through and like get you through this.
Or what's the best strategy while you're dealing with that stress to mitigate it, right? So I think that's one of the most important things for a lot of my people is how do we come up with a strategy that's going to help you best deal with your stress if you can't get past it.
So this is a kind of one thing that I've always appreciated. Like we've met a couple years back, and I think one thing is like your routine. Your routine. You're pretty. I don't want to say regimented, but like you're very good about having positive voices in your ear, having people that you listen to that kind of keep you like even like again like to say you're always happy and not stressed. Like I just don't think that's true for anybody. Like we all have stress, but I think I know you have different like was it Ed Millett? Like you're always listening, and again like those are so vital. And I think. I talk to patients a lot, and like you need to have a routine that kind of works for your life, right? And if a lot of people wake up and they hope their day goes right, and it's like it happens to them, right? And that's why I try to tell people, like if your day's happening to you versus you wake up and you're creating your day, your stress level is going to be vastly different. So if you wake up and you're like, all right, I need to do these 3 things. These other 3 things are not necessary, but if I get them done, that's a win. And you put it out there like this is going to happen right then, it's going to happen there, versus you wake up and you're like, okay, I just need to do this today, I'll do it at some point. And all of a sudden it's like 4 p.m. like I have never done that one call, I didn't go do groceries. That person all of a sudden starts getting stressed out because like all these things that in anticipation of what they wanted to accomplish didn't happen. And that's where I see a lot of people too have stress, is like again, like this idea of having a game plan, like having a daily routine, having a habit kind of that's built in that helps you mitigate stress, like be a high performer. Like how does Tony Robbins run around and do what he does, right? I mean, the guy's on stage, he's flying. Like again, like a lot of those people have so much structure to kind of, again, allow them to kind of knock out a bunch, but do it in the most stressless, or minimal fashion. So on that topic, like, do you have a morning routine? Do you have a like kind of like performance routine to optimize yourself.
Well, that was a beautiful transition.
So,
number one.
Anyways, we're on this topic of stress, and I'm like, you know what? This is one of the things that I admire about you, and I think this is really important because I think it's health, wealth, and the ultimate self. So we're talking about health, we're talking about ways to kind of address it and approach it and try to advocate for you. But how do you become like this ultimate self? Like, how do you push yourself to the max and thrive and not break through or crash and burn out? Like, how do you do that?
Okay, well, number one, Ed Milet would say if things are happening to you, you're always reacting to every circumstance, and reacting to things is not near as good as responding. So number one, things are happening for you, exactly. Not to you. And it sounds funny that I'm saying that, but
Jack Canfield, like that's he's like, again, when he said it, it's like, that's so simple, and I'm an idiot for not really kind of like. He's like, if you wake up and you know, again, you can either react to your day or it can happen to you, right? And it's like reacting is like, it's like if you go and you box somebody, and the one person, if you're always trying to dodge a punch, like that's way harder than you being the one like driving the punch. Like, you know where it's going. And I think that's the way I picture it. Like, if you're just reacting, like, you don't really know where things are falling in your day. And so it's always this reaction. It's always more chaotic. And I see that in people where it's like, if you just woke up early, had quiet time, put the things that you want to have done and put them on the calendar, like, it's gonna happen here. Be selfish, you're gonna have quiet time there, it's gonna happen. And then the rest of the day can go about.
There's so many things that are going through my mind that I want to say. I'm trying to pick out the best things for everyone, but people lack discipline and structure, number one. But I think what's even more important than that is people lack a sense of who they are and what their priorities are in their life. And for me, I'm very clear with myself after doing some inner work on what my priorities are. So if I know what my priorities are and I structure in discipline to create habits that create the person that I want to be based on my priorities, that makes it easy. Not easy, but that makes it easier. And just something that I think about, Steve Jobs had a great biography written about him. I forgot who the author was, but I'm sure everyone knows this by now, but he would wear basically the same outfit every day.
Yeah.
And that was really just to take that decision off of his plate of things that he had to worry or stress about, so that he could make better decisions with the energy that was left over. So in my routine, like, and again, it's easier for me, I feel, because I am so trusting in my faith. So the first thing and the biggest priority in my life every day is reading the Bible. So I read 2 different Bibles every day, Old Testament, New Testament, and I try to align myself with the words that are in there, because that's who I want to emulate, is Christ. And so if I start my day off with who do I want to become and how do I want to live my life, that sets me up for freaking anything that comes my way. And that's the only reason why I'm here today doing this podcast with you, is because I have so much confidence in myself and everything that I'm doing, because that strength and confidence comes from God for me. So anyways, that's the first part of my day, is I wake up early and around 5:30 and I read the Bible, and I do a little, it's called the Wealthy Way Planner, and basically it's just things you're grateful for. You do a little journal entry. It's a prayer for me. I just pray for people in my life or whatever. And then goals. So goals in each area of your life. And I just check off, if I'm meeting my weekly goal quota or whatever it is. But that's really how I start every day, and I make a latte, and then I get to work on scheduling and boring stuff like that. But I think for me, Dr. Zano, if you're out there, he was one of my first mentors. Do you know who he is?
Yeah,
Dr.
he's
Z?
down in Houston.
Yeah,
he's down there. He's a chiropractor, like hugely widely
He built
successful.
the biggest chiropractic
Like,
clinic in the world, apparently. Is
and
what
he's
he's
just
known
a
for.
like machine, like Matt.
Well, he's like super jacked.
Well, but he's a machine in terms of like he's regiment. Like he's just
very.
It's just like to be that busy, you have to be organized with every aspect, or else it is going to be stressful. Because if you got scatter over here or scatter over there, like and with that much volume around you from a business standpoint,
Well, he's also a bodybuilder, and coming from you can't tell now, but I used to be, I dabbled in bodybuilding as well, and bodybuilding teaches you.
He's still a freak when you watch him on so if you watch his like videos, go to Greater Than, you'll see him doing some like power moves that I'm like, yeah, I can't do that. And just dangling like a little monkey up there. I'm like, dude, that guy's strong. So
it's more gymnastics now, calisthenics.
So he may not look like he does in his bodybuilding days, but he's still incredibly pound for pound strong.
But bodybuilding will teach you discipline, because if you're not disciplined, you're not gonna do anything in a show. So you have to be very disciplined and strategic on your day, and planning and dieting and working out. And I think that just like team sports maybe, where that really instills in you these character traits that give you discipline and structure and all these good things that prepare you for hard times in life. He recognized in me, Dr. Z did, after we did this kind of intake, that my morning routine was probably the most important thing that set me up for success every day of my life.
Yeah. I mean, again, I go through periods where I'm up, I meditate, I vision what I want to have happen. Like, hey, and I write it down. Like I'll put it in my, it used to be a paper booklet. Now it's this little tablet, The Remarkable.
Wayne Dyer,
like meditation for manifesting. I would listen to that meditation from Wayne Dyer too. And that's how I got into meditating. I was like, man, I need somebody to walk me through this at first. But put those things down. Because again, you write them down. And again, like I put down 6 things, or I put down 10 things would be usually. I'm like, and these are the ones that are like in priority, have to happen today. And then I'd be like, when are they going to happen? It's going to, this is what it's going to be. Then I'm like, what are my goals? Because again, if you're doing all these things that are not aligning with your core values, your core goals, then again, I think it's going to be more stressful, because you're doing things, you're saying yes to things that if you actually were retrospective, like, I should say no. Or I should just be like, hey, you know what, this isn't for me, and that's okay. I think that's the other, whole other topic. I had a doctor once who, it's like, you should say no 90% of the time. And again, he's like, not in a way of like being selfish, but a lot of people take on things that they really don't want to take on, and they do them because they want to help somebody, but they might not be the best person for it. It's like, or as a business owner, you might do things that like, man, I would have been just way better to delegate it. I mean, I feel like that happens a lot, even at home. Hurt my back doing something I should have probably delegated. So I'm like, yeah, I don't mind doing that. Like, I'm not too like, I can shovel dirt, and you start thinking about these things, but yeah, and so that always resonated with me. And then this whole like morning routine is like, if you don't plan it, it's again like, how do you know it's going to happen? And if those things are important for you and they don't happen, it's stress. And again, and I think that's it. And so I love a morning routine.
And the other thing about a morning routine, or doing hard things in general, is that's how you build confidence. Is by repeatedly doing hard things, or doing the things that you tell yourself that you're going to do. So I see this all the time in running a medium-sized team, that the promises that you keep to yourself are so freaking important, because that determines your self-confidence. And then in turn, that determines kind of your trust that you get from other people. Because I've seen over and over again, people that are consistently late, they're failing to not only keep a promise to themselves that they're going to be on time, but they're going to respect the person's time that they're showing up for. Ironically, I was late earlier by a few minutes, and I live right down the street, but I'm usually very timely.
He was within a minute. You're good.
So if the hardest thing I feel people need to realize and break through is creating habits. Because as soon as you miss your morning routine once, you lose self-confidence in doing it again. And it's a very slippery slope with these brains that we have, that you'll take the path of least resistance.
Yeah.
And it's a path of destruction, and it's a path of losing that confidence in yourself that makes you weak and vulnerable to lots of bad things. So yeah, I think it's super important.
Again, like, this is something where I'll talk to somebody and I'm like, oh yeah, I'm going to the gym today. Like, oh, why don't you just like, you can go tomorrow. And that's like, but again, it's like, no, I told myself I'm going today. Like, and again, you break that promise to yourself of going to the gym, and you make it okay to go tomorrow. If I feel like these are little things that people get into, because then it's easier just to kick it down the road to another day. And again, when you start to look at these things happening, I feel like, especially when people start to feel crummy, like that's where they need the help. And I think it may be daunting to start, but I think once they kind of like, and then too, like the kind of the internal like reward from you accomplishing what you set out to do is the best medicine.
Oh, for
It's
sure.
like, it's fulfillment, right? I think, you know, with a father, 2 young kids, like I really want them to understand, like, you can do anything. And, you know, and there's going to be things that are so hard and difficult, and you might be scrutinized for going the opposite direction, or you might, again, like going the easy route is not always the best route, but standing for your purpose, your beliefs, standing for your convictions, like doing it from a place of love and honesty, and again, and showing up consistently even when no one's looking, is the most important thing. And when you do those things, it's like one of the most like internally rewarding things. And I think that, so talking about purpose, again, you'd mentioned too, like you had kind of found, and things fell into place a lot easier for you when you found purpose. And we kind of talked about, I think a lot of people go through life and they're going through life, they have really not slowed down to connect with their purpose, so that it's easy for them to wake up and grind and kind of do the things to fulfill it. So, you know, you tell me, like, what is your purpose? Like you kind of found it, you dialed in on it, you said that's very easy for you to kind of dial your morning routine around it.
I think that unfortunately for most of us, we don't realize our purpose until something terrible happens, or until we're left by ourselves to kind of clear out all the noise. And there's so much noise these days.
Tons.
So I think for me, it was when I moved here to Dallas.
Because you lived...
Well, I went to school at Texas State University in San Marcos.
Okay.
And then I moved to Dallas for an internship at Baylor Tom Landry, downtown, the big hospital and rehab center that they have there. But I moved here, I didn't know anyone. So I lived up in Richardson. And I moved away from being in school at Texas State, where I learned nothing. And I partied all the time, and it was crazy.
People don't do that in school, do they?
Oh my! Well, this is another level. This is another level, and
worse than tech, or?
Well, you know, it's interesting because I think that everyone says that they party harder than other schools. I think they're all very similar.
Yeah, I think they're all.
But I was in a fraternity, and we went crazy. I failed. I got like a 1.68 GPA in business school. And then I switched my major to exercise, sports science, and physiology. I don't even remember what it's called. But I got a 4.0 in that. I was still partying though. So anyways, I moved to Dallas by myself. And it was so weird because when you have alone time by yourself, and you're not distracted with the same friends around you who idolize the same things that society idolizes, it just gives you this period of reflection time on what's really important in your life. And I would say that maybe I was in a slight depression because I didn't have all those things that I thought I wanted around me. But at the same time, I thought I had a choice that I could try to figure out what I do want and what I should want and what my purpose should be. And that's when I took a deep dive into religion, because I wasn't religious at the time. I'd always enjoyed serving people and helping people. But yeah, I just started studying religions, and the one that I grew up Christian, the one that really kind of resonated with me and I felt drawn to was Christianity. And it just filled a void. It just filled a void. And I know that so many people say that, and you can take it for what it is, because I think it's all very personal. But I don't even remember what the question was, but that's...
How did you find your purpose?
Oh, purpose, right. Okay,
what's your purpose?
Well, back to school, right before I left, I had a class where I trained and helped kids with disabilities. And that was so powerful, because everything I'd done up to that point was basically for myself. And when you're dealing with people with disability, when you're helping people with disabilities, it takes a lot of attention. And just the joy that they have for you helping them is just life changing.
So to share a quick experience, like some of the in high school, I feel I got very fortunate to be in a position during the summers where it was called community living, and you're basically just trying to be like a role model to get kids in your community who have special needs out in the community. And again, at first, like I didn't know what I was getting into, so I was like, "Hey, look, it's good pay, like it's a good on your resume." I'm like, "Okay," but then you kind of like you realize what that did for you as a whole, gives you perspective. But again, I always say, I'm like, man, like you just somebody with Down syndrome, like I would have a whole circle of friends because like their outlook, they're so positive, they're so appreciative of just the things that we should all be appreciative of. And again, they're just happy that you said hi to them, shook their hand, you gave them like you're a good person to them. And I think that's those things like I'd leave those, realize like, man, I need to appreciate way more in my life. Like this, Matt guy that I worked with would be like so happy, and then too like they didn't have that voice in their head saying that you can't do that. The one guy I worked with, he's like, I'm gonna drive a car. I got Down syndrome and I don't care. I'm going to get my driver's license. And I'm like, man, like so many people could benefit from seeing his conviction. And I guarantee you, people told him no, but it was like whipped off him and just like didn't phase him, and he was still so positive and focused. And again, like that's the coolest part. I wish I'd again like go back and track down his mom and him and just be curious if he got his license.
Oh, I was gonna ask if
I need to, because this is my last year I started working with them, and I'm like, yeah, like don't let anybody tell you. If you can find a way to do it, like do it.
Yeah.
But again, it's like, you kind of go with what society kind of like defines for your limits. And I think, that happens, whether it's in the special ed world or even in like, you came from this family or you came from this poverty. Like, and again, I think that's like, you get these societal kind of like limits that people allow to get stuck to them. And I'm like, that's the part where when I worked with them, like, you just saw like that was nothing to them. Like they're like whatever they could be happy from the simple things that we should be able to be happy from, and limits, like a lot of these kids, like they didn't care, like they wanted something, I'm gonna do this, like all right. I had one kid that, hey, on my 19th birthday, can you take me to a bar? I'm just like your brother can do that. I'm like again, if you want to do it, your brother can do that. Yeah. But it was probably one of the most rewarding things. And again, I think that just, for me, it was one of those things that started making me kind of see things differently as a teenager. I mean, like you're 18, 19 years old, partying, like your friends are partying, you start having, like, this is what you wake up and go do. And, their summer job might have been like something cooler, like a server at a restaurant. But to me, like at the time, like no, this ended up being way cooler because I think it had such a more impact on my life that kind of put things into perspective. What really should be like driving points, purpose, like at heart, at least started me going in the right direction.
Yeah, and I had a lot of apprehension to doing that class, and that's what set me up to come to Dallas, and that's why I'm here today. I listen to a lot of podcasts, and recently I listened to one where the person was talking about how it's so easy to connect the dots in your life in reverse from the past.
Yeah.
It's so easy to see how everything was connected, and there looks like there was this perfect plan set in place. But when you're in it, it's just so chaotic and stressful, and you don't know what to do, and blah, blah, blah. But I think a lot of those times you have a choice. You have a choice to do what you feel like you're being called to do and go in that direction or not. And that can put you on a different path. So for me, choosing to go into that apprehension of doing that class with those people with disabilities has led me to who I am today. And that, I think, started my purpose. And for me, I feel like God was nudging me into doing that. Mm-hmm. And that's what led me here today, which is, I think everyone has a superpower within them, and they have to try to figure out what that is and what draws that out of them. What do they enjoy doing? What fills them up and gives them energy? And for me, it's serving other people and helping people through their pain or with their goals or whatever that might be. That energizes me. You can probably tell on this podcast. So anyways, that's my purpose. That's why I'm here, and my purpose has been elevated exponentially ever since I decided to give my life over to God and just be like, whatever you put in front of me, I'm gonna blast through because you're with me, and I would have never done that before.
Yeah, it's so we had a little blip on the recording. We lost some power. We got power back, and during that conversation, I was kind of I want to talk about God. I don't want it to be this controversial like conversation. And again, and we kind of went down some rabbit holes, but
They missed all the good stuff.
we missed some good stuff. And and again, it's like, we went and talked about Hinduism, and like, I think a lot of people have ignorance about other religions, and that creates like emotions about it. It creates misunderstandings, which this creates divide. And again, kind of at the end of the day, people want to have, most people want love, they want security, they want a roof over their head, they want to provide, they want meaning, right? And I think when we look at these things, and I went through, you said you went through like the experience with that, learning about Hinduism, and really appreciated it. I had the same thing, like growing up in a small town, kind of Catholic kind of family, knew nothing about like the Jewish religion. And before I moved to Texas, I worked for a chiropractor in the heart of like Toronto, in the Jewish part of Toronto, and knew nothing about that religion. And again, had no idea about it. So fascinating, like when he would tell me about like the different, like, we're sitting Shiva, like kind of what that meant, and the kind of, I'm like, you appreciate, like that makes sense, like Hanukkah, why you have like 8 days and the oil is only supposed to burn for one, and so all the symbolism and meaning behind it, you start to appreciate, like, oh, that makes sense. And so instead of being this, back in high school, like I had no idea about Hanukkah, I just thought it was some funny Adam Sandler song from Saturday Night Live, and didn't really kind of have the appreciation. There was an ignorance, and you kind of learn about it, like, I can appreciate why they have their holidays, their different things that they go through and do. And I think if we had that experience with kind of every religion, or every kind of religion or philosophy, I think people would have appreciation versus ignorance, or some kind of like hesitancy towards it.
Well, let me tell you, man, I'm going through the Old Testament right now, and there's some real weird stuff in there. There's some real weird stuff. I appreciate it a lot more, and I think ignorance is part of the problem. I think we should all seek to understand more, and then we'll be more compassionate with each other and our different views. But I don't intend on reading the Bible and understanding everything.
No.
I don't have the comprehension to understand something that's incomprehensible. So I don't know why people get caught up on trying to understand and answer every single question, because I don't think some of them will be able to answer.
No.
And
and I think people get pushed away from religion because they can't have this concrete answer sometimes. Like, I need to know, like, prove to me that God exists.
yeah.
And it's like, okay, but like...
Yeah, but then prove that he can't, and then either one can be proved. So we're just...
Well, that's it, right? It's, but and so for me, like, I always, I would take my grandmother growing up, when, just, to me, I like taking her to church at Christmas and Easter, but that was kind of really the only time like I would go. I was playing AAA hockey. I'd be like constantly on the road on the weekends, but I would always like, and again, there's something I'm like, hey, I like this, it feels good. And then again, and kind of going through like medical background, like I thought I wanted to be like a sports surgeon, orthopedic surgeon, and again, when I went to school with that, and that was in my mind, you could tell it wasn't like right, but you kind of go through like science explains everything, and then pushed me probably away from God. And then coming to Texas, still like not against God, like to me, like God's all around me. I feel like there's that connection to the world around you that you can see it, but it was not until I honestly like dissected and did like anatomy lab, and you like kind of just that knowing, like if you dissect and you work on like the intricacies of the body, and you're like, no, like who, like how, like this is so godly, and how it was created, like the path of the vessels, the nerves, the cell, the heart, like then and on top of it, like the person, like you're working on a cadaver, and I was like, oh, this is gonna be so weird, like, but then you had this sense like that part that made that the spirit was not there, right? That kind of part was not there. It was like a vessel, and then those things to me kind of pushed me back into like, kind of this God aspect, and more things just keep reaffirming like this aspect of like religion and God, and pull me back and push me back in, and so kind of like slowly getting my feet wet. It's like, you know what, somebody's like, you need, start with reading the book of Proverbs. And again, when this was part of our conversation offline, was, you can go read the Bible, the book of Proverbs, or different things, anything that's like philosophical or kind of trying to provide insight. It may mean something different to you in a year from now. You might get another kind of layer of insight depending on where you are in that moment, where you've matured, where you've had stress, and it might mean something different and give you like such a guide forward after reading from it. And that's, so for me, it's like, I'm going to read the book of Proverbs one a day and continue to repeat it, and so I might get something else from it month 2. So that's the fun part.
Yeah, I have a lot of thoughts on that. I don't know what would be most helpful for listeners, but I think that I used to hate to read. I used to hate school. I used to hate knowledge. And then again, it was just moving here and getting away from what society wants you to conform to that really opened up my mind. But now I'm very analytical, and I think more logically, and I enjoy deeply to learn. And I think you can get bogged down in trying to analyze the Bible and try to structure it out and really try to understand every single part about it, when I don't think some of it is meant to be understood in an analytical type of way. I think that for me, if we were just to nail it down and say, why do you believe what you believe? I don't need the analytical understanding of every single part of religion or my faith, which I think faith and religion are different. I just know that my life is better when I follow the word than when I don't. And seemingly the people I look up to and admire, the ones that also follow a religion that has a path set out for them that is full of love and compassion, they seemingly have better lives than the other people who do not. And so for me, that's enough. And I don't even remember what you were talking about. I keep forgetting what we're talking about and going down these rabbit holes over here.
Talking about, we got on the conversation about, finding, again, how do you serve your purpose? And then
purpose, that's right.
And then we evolved to like, how does God fit into that? How does, religion, spirituality, faith feed into that?
Well, I think that happened because we all have, I think most of us have this void that comes up in our life that we try to fill with different things. And I think eventually we figure out that most of those things don't fill that void. And
drugs and alcohol don't fill that void.
Drugs and alcohol, fame, accomplishment, even for some people, maybe it's families. I know that that's a hot topic, and I love my family more than anything in the world, but I know that for me, there's still a void that sits when I don't have a connection with this certain thing that I call my faith. And I think that if people just explored that a little bit more and didn't take it as such a polarizing hot topic, whatever, I think that would help them find their purpose more. And yeah, that's where I sit on that.
It's interesting because I feel like, you can look through and look at people who have gone through different hardships, and I feel like I look back and look at like what got me through hard times. And I lost my dad at 11. My mom passed, from Alzheimer's and pretty young. And again, like you talked about, like family, like sometimes fills a void. And for me, I'm like, yeah, I miss them. I miss them dearly. But I think, when I wake up every day, if I sat there and just looked to them to like fill that void of like, why am I here today? Like, I think I'd be in a world of sadness. And I think, and that was kind of when you said that. And it's like, it's interesting because when I wake up every day, it's like in my head, like I just want to serve people. I want to help people. I want, like, if I can enrich somebody's life, like yeah, my wife jokes like, oh, if you get talking about something you can help them with, like it's gonna be like it's not gonna be 15 minutes, Matt. And it's like,
No way.
because it's like it's energizing, right? And again, I want to give and help, and so I think that's one of those things where it's like every day, like it's interesting when I do get in ruts or kind of like, oh yeah, like I miss my family. Like yeah, we all have those. Like we all have like dips or depressions. I feel like again, knowing how to hit the reset, like I have my things like morning routine reset. Like I missed it for 2 weeks, like traveled, conference, back, chaos, like quiet noise, like get back to like connecting, planning, intention, your purpose, and like serving your big purpose, like what ignites you. And I think that's again when you talked about family, like because again I think a lot of times people are like, yeah, family fills a void. Exercise can fill a void for some. Versus to me, I need exercise to keep me going on my purpose, right? Because the healthier I am, the longer I can do my passion and my purpose, and not the other way around. Like I don't exercise to fill a void, and yeah, I feel good, but like it's really because it powers me for my purpose.
Ooh, that's good.
And same, food. Like I think that's it. It's like when you start, and I think that's this whole kind of maybe we're evolving to or not, but kind of like how do you we'll have people come in and do you mind? Do you drink? Do you all?
Rarely.
Really? Like, I don't like. I might have maybe 3 drinks a year, but when I tell people like, I'm good, I don't drink. It's like they look at it, what? I'm just like, it doesn't fill my purpose. Has nothing to do like about me being an alcoholic. Has nothing to do with that. It potentially has. It's if I don't feel great. Like I wake up and I feel like I wake up the next day, not hungover, not. Like I still went to bed at 11, but I feel like it takes me enough off course from my purpose of like having the energy to do what I want to do that day that I'm like it's not worth it. But again, I always like, do you ever like if people like they look at you funny like, why aren't you drinking? Like why aren't you doing that societal norm?
Oh, it's tough.
Right? And it's like I'm like, hey, I'm not judging you. I just know that in my head, like I am driving here, like I am full steam ahead for fulfilling this. And if I do these things, like these are distractions off the road. And for me, it's like, is that distraction really worth it? No.
I feel the exact same way, but some people want those distractions.
Correct.
Right? That's the crazy part.
I don't understand. Again, I understand why it can be a coping mechanism or a distraction. But it's like, what are healthier ways of like doing it? And as a healthcare provider, it's hard because people are like, don't tell me I can't have my 2 glasses of wine at night. I'm just like, I want you to make that decision on your own. Like I want you to see how it's taking away from maybe your health goals or your purpose. Because I think a lot of times when people come here, they may have anxiety, have headaches, or they go to you, they have pain, they have something disrupting their life that's enough to drive them to us. But again, like at the end of the day, it's like it's pulling them away from something they're meant to be doing. Right, like the anxiety prevents them from being calm and experiencing, like potentially fulfilling their purpose. So it's like one of those things where like, how do we get people when they come in to see us, like to see their purpose and start like, oh yeah, this makes sense. Like this is so clear. Why would I do this if it takes me away from serving and getting to that purpose? I don't know. It's just a thought. It's like.
Well, that's freaking. That's another rabbit hole.
It is a rabbit hole, but it's one of those things where I just. Yeah, like how do we have these harder conversations with patients?
That's difficult, especially when they're in pain because you want them to relax.
Mm-hmm.
So,
well, a little different on you're like physically with them. Right?
Yes, that's true. When I have somebody on the table and we're talking about something difficult, they're gonna tense up immediately, which is exactly what I don't want them to do. So I have to regulate my nervous system and their nervous systems and put them in a safe place where they can relax so that my technique and my therapy actually work. But you're right, that doesn't get to a lot of the root causes of maybe why they're creating that tension in the first place. And I think we live in a society where it's not super cool to pursue your purpose because maybe that goes against some societal norm.
Yeah.
And also, you just made me think about maybe I was drinking alcohol to distract myself from school.
Maybe. Hey.
Maybe I was doing drugs and alcohol just as a distraction from school because that wasn't part of my purpose. I don't know.
Or again, like it was, Canadian, Irish Canadian, like I drank plenty, partied plenty, and again, like I don't know at what point you kind of realize like this. I'm doing this for like to have fun and be cool, but this is not deep down filling a purpose. Like I wake up if I'm not fulfilling my purpose, like there's a big void there, versus like you drinking and waking up and that doesn't touch your purpose, and the void's always there. You can drink again, have fun, and yeah, you're laughing, but for me, it was like I'm not sure where it kind of clicked, and it was the same thing. Like when I was in chiropractic school, they'd be like, people are like, oh, why are you studying? It's like, why wouldn't I? Like I know I can do this. Like why do you have to be a perfectionist? Like because I know I can. Like I know I can go in and like be the top of my class. Like like to just go and coast through. Like
well, that's very rare.
But it's like it's the same thing. Like at that point, so in my second year of school, I went through. I thought I wanted to do medical research. I'm like I want to do like be a lab rat and study stuff. So I was doing like biomedical. I went to the dean of biology. I'm like, look, I want to either be an orthopedic surgeon or I want to be a chiropractor, and I want to help people that way. And he looked at my grades, and again, they were like 75%. Like, but to get into med school, to get into these schools, he's like, you don't have what it takes. And I was so freaking pissed. But at that point, I'm like, no, you don't understand. Like this first year I came down here like thinking I wanted to do that, but it was just like off a whim. Like it wasn't like a mature decision. I realized like I went through a sports injury, and I kind of like made me realize like, man, like I want to do this. I want to help people, perform and to be their best. And so that was kind of like got me going in this direction. And at that point, I was like, you're not bumping me off this path. But I remember going to this, and again, I was just so angry at him. And maybe he was doing this on purpose. He's like, yeah, I don't think you have what it takes. And it's like, it's funny. Like, do you know who Chet Holmes is?
That sounds familiar.
Tony Robbins has had some, like, he's passed away, I think, back in like mid 2015, 2016. But I remember listening to a podcast with him and Tony Robbins, and he would just say to like he would interview people and teach like businesses how to like kind of weed out the riffraff of people, because a smart person is going to tell you what you want to hear. And so he's like, look, you got to put them on, like make them fight to show that they really want to be in your organization, like they really align with your purpose. And he's like, it may sound bad, like it may be an HR nightmare, but reject them. And he's like, if they are like, this is their dream job, and it's not something just to pay the bills until they find their dream job, because you don't want to waste your time like bringing on, because it weakens your brand, weakens your purpose in fulfilling it. Reject them. Say, look, don't, a lot of times you get chatting about the job, and he's like, hey, great, like, yeah, after talking, like, I really don't know if you have what it takes to be in this business.
Because that'll drive them.
And again, and the right person, if they're really there for the right reason and that's their passion, they're gonna be like, no, like, what did I, like, they're gonna fight for it. They're gonna be like, let me show you, let me prove to you.
Ooh, that's good.
You know what I mean? And so again, in my head, after hearing this, I'm like, was that what the dean of biology was doing to me? It was like, even
if he wasn't, it worked.
Again, regardless of what it was. But I remember walking out of there. I think I told now my wife, who was my girlfriend at the time, like, I was so pissed. I'm like, he told me this. And from that moment on, like, I had like straight A's, because again, I'm like, I never wanted somebody to doubt me. I never wanted somebody to dictate basically my limits. To me, I'm like, you don't know me. And that was like, and ever since, so came to school, was I'm like, hey, look, I'm here for a reason. I'm not here to party. I'm here because this is my purpose, is to help people, and this is going to get me there. So the better I perform at this, then when I get out of here, I can be a better performer in terms of serving my purpose and helping people. So why would I, kind of settle for a B if I don't have to? If I can get an A, like, I don't care. I don't just keep studying and get the A. And it was like ever since, and it was just one of those things where momentumly changed me. So as much as I want to go back and slap the guy that told me that, I'm like, I should probably go back and thank him.
Well, Tim Grover was Michael Jordan's coach and Kobe Bryant and some other people, and he says the same thing that Andy Frisella and Ed Milet say, and a lot of these guys had chips on their shoulders, and that's what created a lot of their massive success, right? So that goes a little beyond purpose, because I think they found their purpose, but then what drove them to becoming highly successful were these other factors. And for a lot of them, it was somebody doubting them and them wanting to prove that person wrong, Or I know people that work for me that are very successful or that are my peers, and family members that doubt them drives them crazy, but crazy in a direction of proving them wrong.
Yeah.
So that can definitely be a factor. For me, it's my faith now.
Yeah.
But I think you have to find something that drives you intrinsically. But before that, you have to find what you want to be driven to.
Mm-hmm. Yeah. Anyways, from a partying college student, like again, it was probably an initial phase of finding like stumbling on a purpose and realizing too, like, you know, now you kind of line that purpose with God and you pull that into it. It's like, you know, how do I serve effortlessly and ask for nothing in return? Like I want to help people.
Well, that's a good way to get out of your head, and that's a good idea for people out there who maybe don't know what their purpose is. Get out and serve someone else.
Yeah.
And it might get you closer to being out of your head and seeing, you know, you're helping somebody else. What else could you do that's useful to society? Because we want to be useful and we want to contribute and we want to feel good about doing those things. So that could be something that maybe leads you to finding your purpose. But one thing I want to say is that I think you have one of your superpowers is being really smart. So I think you're gifted with being highly intelligent.
I appreciate
sounds like it from when you were young. But I think that most people, myself included, when we were young, we were taught that you can't do anything. And there are limitations that you have, and you're just not going to be able to do certain things because of how tall you are, or how much money you have, or what color you are, or whatever. And what I've figured out is that's wrong.
Yeah.
That's false. You can do whatever you want to do as long as you're willing to put in the time, the effort, and maybe the suffering to get to that point. You can literally do whatever you want to do. I really believe that now, and I'm doing things currently that I would have never in a million years thought little Scott walking around with his briefcase would have been able to do.
You walk around with a briefcase?
When I was a little boy, I had a vision of people wanted to be firefighters and stuff. I wanted to be a businessman. And I think that was partially because I grew up with a single mom and we didn't have a ton of money or whatever, so I wanted to probably have a bunch of money one day, subconsciously. So yeah, I walked around with a little briefcase.
Interesting.
But all that to say that I think people can literally do whatever they want to do, but I think that they should take that with a grain of salt, because becoming really successful and getting the things that you want, the higher on the totem pole they are, require an immense amount of work and usually suffering to get to that point. And it's how you overcome and deal with that suffering that allows you to accomplish that goal. And that could be like a part 2 of the podcast, because that's a whole nother topic.
Yeah, I think I had a little segue into something I wanted to spotlight, because I think it's important that when we're on a really good point to transition to it, but that suffering and like fighting through it is probably the most rewarding and self kind of growing aspects. Like when it is hard, when you have to wake up at 5 and train, like if you're doing a fitness competition, like that's not easy, like, but being dedicated and fighting through and saying no when like people are wanting you to pull you off your game plan and getting to the outcome that you thought was like, holy smokes, that seems so far away, and then all of a sudden you're like, I'm here. Like, and it's like there's nothing, you can't bottle that up. That in a medication, in a substance, you know what I mean? Like that feeling of like accomplishment from just hard work and doing it for not an external reason, for intrinsically, like I'm serving this purpose.
Yeah, except for that Ozempa seems to be having some effects on people. They're losing the weight, but they're having some symptoms.
They're having some symptoms. So kind of going and segueing. So greater than performance, you opened up in 2019 in July, but you formed a foundation called the Greater Than Foundation. And so talking about giving back, I think that's kind of where I'm like, oh, we need to talk about this. When did you start this foundation? Did you start it right out of the gate, or was this something that you're like, hey, I need to do this, like, you know, after you got moving along in business?
Oh, well, I think that I don't recall everything that's happened in the last 4 years, but I can tell you that we started it very soon after we started Greater Than because, again, I always had a heart for trying to help as many people as possible. And I knew that if we created a foundation that we could help more people. And that if we took a percentage off of what we make at Greater Than and gave it to the foundation, we'd be able to help even more people as we grew. And the more we grew, the more the foundation would grow, the more people we could help, and that just leads to my purpose. And so that's why it was formed. And every year now we have a gala that's coming up. You're invited May 18th if you're around. It's
Definitely.
at Lakewood Country Club. We do an silent auction. We do awards for our staff. We have several nonprofit partners, Dallas Amputee Association, or Network, Dallas Amputee Network, Cornerstone Crossroads Academy, private school, Dallas Wheelchair Tennis Team, and a few other smaller ones. But basically what we do is we raise money for these other nonprofits and we just help them out. And we also just help random people who need help. So our mission is to serve the disabled and disadvantaged in our community, however we need to do that. So yeah, they're interconnected.
That's awesome. So the gala, is this open to the public? Is this by invite only? How does that work?
We're moving more towards it being more open because we just want more people to be there and be involved. But it is invite only currently, or you can say that you saw the invitation and you want to go, and that's an invite too. But yeah, if anyone listening is interested, it's every year in April or May, and it's usually at Royal Oaks Country Club or Lakewood Country Club.
Lakewood this year? Or
Lakewood this year.
Or was Royal Oaks last year?
Last year. We have a lot of Royal Oaks people at the gym.
So Lakewood Country Club here in Dallas. Not saying to show up unintended or uninvited, but and what if, again, like you said, it's not open yet to the public, but they're like, I do want to support. I don't want to show up and crash a party. How is there a website that they can go to make a donation, to find out more about your foundation, to support it in any way, shape, and form?
Yes.
And obviously, if you need a place to train, again, this is something where, like, you as a provider, you want to know people are going to places where, like, hey, they're in good hands, and they come from a place of, like, serving that's honest, and this is a place that, again, like, I want my patients to go there and train. We have voucher, like, hey, you want to start working out, go meet with them, because they're going to be the brand that you want. How do they find
So Greater Than Performance and Rehab.com is our main gym and therapy, and yes, you have to type that whole thing out. I've not figured out how I want to shorten it yet.
I went through the Wellness Institute at Dallas.com.
There you go,
I went through, I'm like, gosh, shoot, I didn't really think about that, typing that.
And then the email. Greater Than Performance and Rehab at gmail.com.
We and then writing it down on a check. So now we, like, our bank is just TWID, TWID. Like, it's like email, TWID emails.
Oh,
like,
that's
it just,
funny. That's good.
We made it much shorter, but not on our website yet.
Yeah, and then it's just thegreaterthanfoundation.com. And
Awesome.
you can learn all about our stuff, and we do have really good trainers if that's what you're looking for.
And I think too, like, I know Pilates you just added into the...
Yes, it's more rehabilitative Pilates, which, I mean, it's another topic, but I mean, every industry has different levels of practitioners, and to say that you're in rehab or therapy, really in whatever thing that you're doing, I think you have to be a certain level of skill to do that. So our rehab Pilates instructors are really good. Most of our trainers are also massage therapists, so they do manual therapy with their clients, which I fully believe in. We're going to create our own educational system, hopefully soon, on training other trainers and PTs and massage therapists to start incorporating some of these more integrative components and techniques, because they provide the best possible session for the patients or the clients coming in.
Yeah.
But yes, we have Pilates, physical therapy. We have a chiropractor, but it's weird because he only does personal training. Amrock, if you're watching, you're amazing. And he does body work and stuff, but he loves training.
Guy's also a beast in the gym.
He's a beast.
He is. I watch him like, that's quite the squat. Good form, gets deep, but doesn't compromise mechanics either.
No, and he is Asian, so he has that Asian squat.
But yeah, no, you guys are great. I think if you guys are looking for any more information to support the foundation, or again, you need a gym and you're in the area, Greater Than Performance is
Absolutely.
the place to go. And then, I mean, I'm sure we could do another one, but for time's sake, let's wrap it up. And anything that you want to share, anything else besides the foundation, the gala coming up?
No, I appreciate you inviting me. This was great. This really makes me want to start my own podcast.
You should. I
It's a
can
lot
walk
of
you
fun.
through it. It seemed like a daunting task. We kicked the can down the road for probably 2 years, and I could probably walk you through it, and you'd be launched in a week.
Yes, and that's another podcast episode that you could launch because you were explaining it to me earlier, and that would be very beneficial.
Definitely can do that.
All
All right, sir. Thank you.
Yeah, absolutely.